good morning, first off. As Mrs. Lambert said, my name is Josh Bollier, and I'm a battalion chief for the Town of Manchester Fire Department. So I'm looking forward to telling you guys a lot about what I do, and more importantly, I think more broadly, in line with your class here, we're going to focus on emergency medical services. And I just finished telling you I'm with the fire department, so what does that have to do with emergency medical services? Well, in Manchester and in a lot of different communities, emergency medical services is very, very much intertwined with the fire service. And we're going to get into that a little bit too. So to start off with, my job with the fire department is to manage emergency medical services for the town. Like I said, I'm a chief officer, which means right now I work mostly in administration. I still get out into the field to go to some incidents and supervise and get out of the office once in a while, but probably about 75% of my time is actually managing programs now. So one of the things that I do is come into classrooms like this and give students like yourself kind of an overview of what emergency medical services, the fire service is all about, and do presentations. So, and for me, this is a lot of fun. I enjoy sharing our work with whoever we can. So, to get started, like I said, this is going to be interactive. I'm going to ask you guys some questions, and I'm going to hopefully get some questions back from you as well. So, my first question is, what really is emergency medical services? Who has any exposure to emergency medical services? Maybe a family member, or a friend, or something you pursued previously? Anyone? Go ahead.
My little sister has diabetes.
Oh, okay. So you've interacted with emergency medical services? You've had maybe somebody come to your house to help her out? Okay.
When I was younger, my dad's lung car collapsed, so I was able to send him to pick him up.
Okay. So again, kind of an end user of the system, right? Somebody who needed help you're familiar with. Anybody in the room know anybody who's in EMS now, or the fire service for that matter? Go ahead.
Yeah, my boyfriend's cousins and uncles and stuff, they're all EMS.
Oh, good. Yeah, around here?
No, Rockville.
Rockville, great, okay, all right. So, when we talk about health professions, emergency medical services is probably one of the youngest. Now, I'll qualify that. There's certainly some high-tech fields that are younger than EMS, like radiology and some of the other allied health professions that are really kind of focused on some technological advances in medicine. But in the broader sense, emergency medical services has only been around for, who knows, any idea how long we've been around for? Really, as kind of an organized discipline?
100 years.
Even less, since about the 50s and 60s. Really, and emergency medical services developed from a need. And at the time, the need was trauma. Okay, people were getting hurt. And we, as a country and as a world, really, emergency medical services is pretty universal. There was a recognition that people were getting hurt. They weren't getting hurt in hospitals or where doctors and nurses were available to help them. And we needed to find a way to provide some care where they were getting hurt, or at very least, and especially early on, get them from where they were being hurt to a hospital or somebody else who could care for them. And emergency medical services, EMS, was developed to fill that gap. In the United States, the National Highway Traffic Safety Administration is responsible for the initial training plans, training programs for early first responders, first aiders, and what developed into EMTs and paramedics.
They're building a cafe downstairs.
Got it.
Every class, every once in a while, they will be drilling.
Understood. All right. So, again, we think about traffic safety and an organization that has a lot to do with highways and roads and cars and that sort of thing. How did they get involved in medicine? Well, the connection is we had people getting hurt, and where most people were getting hurt in the 30s, 40s, 50s, and 60s that needed emergency transportation to a hospital instead of a doctor or a nurse coming to their house for an illness was car accidents, things out in the streets. Cars today are much, much safer than they were 50, 60 years ago. And so that was the need that was being addressed. The problem to be fixed was, how do we help these people who are getting in car accidents? So the NHTSA developed a plan in conjunction with some other organizations, some medical organizations, to put people with some basic first aid training in the right place to help these people. So we'll fast forward decades, and emergency medical services today is much more than picking up somebody who's bleeding from a car accident and rushing them off to the hospital. In 2014, paramedics in the field are providing much of the same level of care that can be provided for in an emergency department for somebody who's critically ill. That includes lots and lots of medications, lots and lots of different technology to manage cardiac and respiratory emergencies, and certainly a lot of technology and capability to handle trauma. And we do this in not just the first ambulances. Who knows what they use for the first ambulances? Any idea? There's a little history lesson too. What's that?
Wagons.
Pretty close to wagons, yeah. Some of the first ambulances were actually hearses. So why would a hearse make a good ambulance if you just needed to get somebody from point A to point B?
A lot of room in the back.
Well, there's lots of room in the back. They've already got little stretchers, and there was room for somebody to sit back there with them if they had to. Early ambulances, actually, there was no attendant with the patient. They just loaded the patient and took them off to the hospital. So the hearses were a good fit for the job at the time. And now, of course, we look today and ambulances are big and elaborate, and depending on what community you're in. Some of them are vans, some of them are much larger trucks. But the difference from where we started to where we are now is that ambulances are packed with equipment and supplies to actually provide care as well. And there's room in most ambulances. You can fit the patient plus 2 or sometimes 3 attendants, EMTs and paramedics to assist in the back of the ambulance to care for somebody. So again, going from where we started to where we are now, really in a short period of time. If we look at medicine as a whole, nursing has been around for hundreds of years. Physicians have been around for hundreds and hundreds of years. A lot of other disciplines are much older than emergency medical services. So that's brought with it some challenges as well. Anytime something's new and in the stages of being created, there's some things work out well when you're putting something together, and some things don't. They need to be changed. Emergency medical services has experienced the exact same thing over the last 60 or so years. So that's a brief overview, very, very brief overview of kind of where the career has come from and where it is now. I'm going to get a little more specific as well. So I'm going to switch gears, and I'm going to talk about my own circumstance for just a second. When I was in high school, my first exposure to EMS and fire service was really through some friends. Actually, some friends that went to school right here that at the time happened to volunteer in the 8th Utilities District Fire Department. Anybody know where that is or familiar with it? Okay, yeah, sure. So in Manchester, a quarter of the town's covered by a volunteer fire department, and the rest of the town's covered by my department. And so I had some friends in that department, and through those friends, I kind of got to see a little bit of what they did, and it was a little bit interesting. But honestly, there was nothing in high school that I was really interested in pursuing. In high school, I had my heart set on going to veterinary school. And taking care of sick animals and taking care of sick people pre-hospitally are two very, very different things. And it was when I was in college, a friend of mine, again, same guy that was volunteering down here, was taking an EMT class. All right, his first emergency medical technician class that the fire department was putting him through. And he said, hey, this meets Tuesday and Thursday nights for like 6 months. Do you want to take the class with me? I said, well, that sounds kind of interesting. It can't hurt. I have free time on those nights. Yeah, absolutely. Let me take the class with you guys. And I found very, very soon in that class that, my God, this is really interesting stuff. And by the end of the class, I could see that what these EMTs are doing out in the field, this has a direct impact on people. And these people, these EMTs, have an ability to help people in a very, very tangible, immediate way that you can see and feel. And this is exciting, too, because these guys are now going to they're going to sick people, but they're also going to some really, really you know, kind of some crazy stuff. They're going to car accidents, they're going to fires, they're going to scenes where you're talking about high energy and people that really, really need help, and these guys are the ones providing the help. So for me, that's the point where I said, you know what? I might really like to do this as a career, and I think I'm going to pursue this a little bit further. So I kind of, at the time, I was doing my undergrad stuff, and I kind of switched some of my courses around and took the focus a little bit off of what I thought I really wanted, and started to look at this as a different career path. And so after I finished my EMT class, I got a job with Ambulance Service of Manchester in town here, part-time, you know, when I wasn't in class, and started working on an ambulance. And that only worked to solidify for me that, you know what, this really might be the right career path for me. This is what I want to pursue. And at that time, I had the opportunity to start working with paramedics. So I started working with paramedics from the town fire department, where I work now. And in Manchester, the ambulance service runs with the fire department. The fire department provides first responders, which we'll talk about in a minute, and provides the paramedic service. And the ambulance service provides EMTs for transport to the hospital. So at the time, I was working with a transport agency, but we were going on calls with the fire department, and I got to work with these different paramedics. And after about a year, I said, you know, I really love what I'm doing, but I could do what those guys are doing. And those guys are really, really doing some interesting stuff. They're giving medications, they're helping people with heart attacks and cardiac arrest and severe trauma, and they're providing treatments that doctors and nurses are doing in the hospital. They're doing in the field. I want to do what those guys are doing. So I started looking into paramedic school. And after being an EMT for only about 2 years, I got into a paramedic program out at Yukon Health Center. And I did that while I'm still working full-time at that point, full-time at Manchester Ambulance. And I got through paramedic school. And at the time, we'll talk about some changes in the paramedic program and the EMT program in a minute. But the paramedic program was offered full-time, Monday through Friday, 8-hour days, plus a couple 10-hour weekends and some nights for clinical time. And we did the whole thing in 5 months. Today, an average paramedic program, you can't get through in less than 2 years. They don't offer, as far as I know, I'm not familiar with anybody who offers a Monday through Friday intensive program anymore. Plus the hours, the hour requirement has gone up a lot. And so I'm talking about 1995, 1996. So this is a long time ago. And I pretty much when all you guys were born, right? That's pretty much where we're at. Yeah. That doesn't help to make me feel any younger, but so when I was sitting right where you guys are, a few years after where I was sitting right where you guys were, that's when this is taking place. So a lot's changed in the field too, and just like any other field, with time and new advances in science and technology, course loads increase, the scope of knowledge increases, and they build those things into the programs. So like I said, you know, a paramedic program that was somewhere in the neighborhood of like 800 or 900 hours plus some clinical time is now, you know, add 500 or 600 hours to that. I'm not sure exactly what the numbers are today, but it's a lot. And I finished my paramedic program and continued to work for Manchester Ambulance, now as a paramedic for another 2 years, and I started applying to fire departments. At the time, I had also started volunteering in the 8th District as a firefighter, and I kind of got got some interest in that as well. And again, I found 2 things that I really, really wanted to do. I wanted to be a firefighter because, quite frankly, that's way cool. Lots of people make movies movies and TV shows about what we do for work, and it's exciting. They do that because it's exciting. It's a fun job. Most of the time, it's fun. And I really wanted to do that, but at the same time, I couldn't get over the fact that EMTs and paramedics could really, really impact people's lives. We could help people immediately out in the field, and I can't explain to you what kind of a feeling it is to have that impact on somebody's life. So I definitely didn't want to give up on that either. And so to do both, the best option for me was turn to the fire service. Because as I said, a lot of fire departments manage emergency medical services for their communities. And in this area, two very close examples of that, Manchester Fire and East Hartford Fire, all of the paramedics for those two fairly large communities come from the fire department. So in 1998, I tested through and was hired by the fire department. And again, I hit the jackpot, you know, I hit the lottery. I got a job that I really loved, that I could do the things that I really love. I'm helping people, it's exciting, I'm going into burning buildings, and what more could I ask for? So these things fell together for me, and I was able to find something that I was passionate about and can continue to be passionate about. So over the last 16 years, obviously I'm not working directly as a firefighter now, but in the fire service, the other great thing about the fire service and a lot of emergency medical service companies is there's room for advancement, there's room to branch out. In emergency medical services, some people stay working on an ambulance, some people get into a flight program, some people get into teaching, some people work in hospitals, so it's not all the same, you have options. In the fire service, it's the same thing. Some people get into the fire service and get into the fire marshal's office and do investigations and inspections. Some people, on the line, you can work on an engine company, and that's one function. You can work on a truck company, and that's another function, and a rescue company. Those are different functions. You can promote to company officer. You can promote to captain or chief officer, and there's lots of different ways to go. So, on top of being able to find two career paths that came together nicely for me, both have a lot of room for movement and advancement, and it's been a really good fit. So, that being said, I'm not going to stand here and tell you that being a paramedic, being an EMT, or being a firefighter is for everybody. One of the most important things that people find out, I think, in riding with us or doing some form of ride-along or internship or look at these as a career field, some people say, yeah, you know what, this is for me, I can do this, I'm really into this, and I like the excitement, I like the challenge, I like working and helping with people. But just as many people say, you know what, this is not for me, I'm glad I looked at it, but I'm going to leave this to somebody else because maybe this isn't within my comfort zone. Maybe I don't like heights and I don't like fires. I think it's crazy to go to car accidents. That's great. Sometimes just investigating, like any career, you need to take a good look at it and say, well, maybe this is for me, maybe this isn't for me. So the people that it is for have a few things in common. Okay. Typically, I find on my department and other departments, I do some teaching as well. I teach in some paramedic programs, and like I said, I've been around the industry for about 20 years now. I've seen a lot of people come in into EMS, and I've seen a lot of people leave EMS. The people that stay know pretty early on whether or not EMS and fire is for them, and they stay and they love it and they're passionate about it. The people who leave realize pretty early on that it's not for them, and most of them move right on to something that is for them. This is not a wishy-washy field. This is not something that you can do if you're not really passionate about it, because it will get to you. Like I said, some of the things that we do are wonderful. I can't count how many times I felt like I had a direct impact on making somebody feel better, improving their circumstance. Maybe it's protecting their property. Maybe it is keeping them from dying. Maybe it is just comforting a kid. That part of the job is incredible. You only get that in a few fields. And I truly believe this. I haven't been in a lot of other fields, but I can tell you that in medicine, doctors and nurses and paramedics and EMTs have the ability to really, really directly impact somebody's health and well-being in a way that is difficult to describe. And it's always a good feeling. So, the other side of that is, of course, we see a lot of tragedy. And this is the part that doesn't, gets to some people. So, over the course of my career, I've been to a lot of situations where we just couldn't help. We weren't, timing, circumstance, we can't save everybody, we can't make everybody better, we can't improve everybody's condition. But we do the best we can, and fortunately, for those of us that do this job, the good has always outweighed the bad. But there is always the bad, and sometimes, some things can be so bad that people have to leave the career field. Some people have to move on to something else because, like I said, think about tragedies that happen in the community. Think about how those might impact the people that certainly are affected by the individual with the tragedy. Also, there's always the people that have to support that, respond to that, manage whatever that tragic situation is, and that weighs heavily on us too. So that's the downside to it. And sometimes that's dead babies. Sometimes that's people that that are injured. There's a lot of different ways that can go. So it's not all roses and ice cream, but there's certainly enough in this career path that is great about it to, for me anyways, offset some of the negatives that come along with it. So, I've been at it for about almost half an hour now. Wow, that goes by quick, huh?
We have time. We have plenty of time till 20 after.
Yep, perfect. So, why don't I take a 2-second break here and ask you guys a few questions. So I know what I know about this career field, but what's interesting to you? What maybe that I've said already, or I haven't said, you haven't heard me say, would you like an answer on or to talk about? Go ahead.
What education did you do that was required for your job?
That's interesting. Okay, so that's a good question. Education. So for the position that I'm in now, as a chief officer, I had some additional requirements from entry level. Entry level firefighters right now, we're requiring minimum requirements to come into the fire department, a graduation from high school, driver's license, clean record, and we require our new employees to come in with a paramedic license. Different fire departments may require an EMT license, an EMT certificate. Some don't have an EMS requirement. Some will require that you've already taken some fire academy classes. Our new people coming in the door, for our department anyways, come in with a paramedic license, and if they don't have any, regardless if they have any fire training or not, we send them to the fire academy. So our fire academy is similar to a police academy that you might be more familiar with. It's a residential program for 15 weeks. We send them up to the academy, they live there, and when they come back after 4 months, they've got a lot of different training and certifications in firefighting, and rescue, and hazmat, and some EMS. And so when they start to work for us, they've got the education, but now we put them into a precepting, a kind of a field training program that validates that they know what that they're supposed to know, and that they can actually take this knowledge and apply it. Okay? So all of our new people work with seasoned people or officers for another 2, 3, sometimes 4 months before they work independently. And that's to learn the trucks, learn emergency vehicle driving, learn our procedures and protocols, and demonstrate that they can actually do all of these things on their own. In EMS, to give you an idea of training levels, emergency medical services right now in Connecticut has 4 levels of practitioner that they recognize. The first is a EMR, emergency medical responder, which is about a 100-hour course. Teaches advanced first aid, some bandaging and splinting, recognizing life-threatening emergencies, applying oxygen, and stabilizing a patient waiting for somebody else. The second level is EMT. An emergency medical technician right now I think is about a 150-hour course, 160-hour course. It builds on the EMR. It adds some additional use of some basic medications like EpiPens, nitro, aspirin. It gets a little bit more into oxygen use and immobilization. And the third level is it's called an EMTA now, or an advanced EMT. Now in Connecticut, this one, we've been struggling with this level for a while because it's really not an EMT and it's really not a paramedic. It still exists in some areas. The difference between EMTA and an EMT is that the EMTA can now start intravenous lines, start IV lines, and give fluids. They can use some advanced airways, different types of non-invasive airways to help people breathe. And there's an additional little skill set above the EMT that goes with that level. So that, to be an EMTA, you take the EMT course, and then there's an add-on of about another 100 hours or so to that to be the EMTA. And the last level is paramedic. Connecticut licenses their paramedics, and the paramedic program right now in Connecticut, the classes, the entry-level classes are all run through they're all affiliated with the college, and most can be taken as an associate's degree, and usually they can also be taken as a certificate program. In either case, the program is divided into your classroom learning, your didactic, which is, I should have these numbers, but somewhere around 700 or 800 hours of classroom time. And then there's clinical time, which is spending time in the field with other paramedics. And then there's other clinical time, which is spending time in the hospitals with different disciplines to learn more about what they do. So in your hospital rotations, for instance, a paramedic student may spend time in labor and delivery delivering babies, and then go to the OR and intubate, put tubes in people's lungs so they can breathe, and then go with a phlebotomist and learn to draw blood and start IVs and give medications through IV lines. And these are all individual specialties, right, in the hospital. Pre-hospitally, we expect the paramedic to know a fair amount about each one of these, so we put them with the specialist in the hospital for different rotations for a few weeks at a time to get that background. And then when they come to the field, they've done these things in a more sterile setting, right? A more controlled setting, so that when we have to do these things in a living room or a car, there's a level of comfort there that they already know how it's supposed to go. So when that's all done, there's a testing process for paramedic. There's a national registry test that they have to pass, a practical piece, hands-on doing with a written exam as well. And when they get their license in their hand, before they can work as a paramedic, then there's another, in our agency, it's between 8 and 12 weeks of precepting time that you ride with a paramedic that's already working in the field to get the hospital to allow you to work independently, because we all work under a hospital. The hospital has to say that you have medical control, that they believe that you know what you're doing and you're safe to make good decisions in the field, and they sponsor you. So Manchester Memorial Hospital sponsors all of our paramedics to work independently in the field, and that's another training piece. So for somebody coming into the field, if today you decided that you might want to be a paramedic sometime down the road and work for a fire department, it's a minimum of about a 5-year process. Okay? From the time you make that decision, you need to take an EMT class. You need to go through that process, get a little experience. Most paramedic programs won't take anybody without at least a couple years of field experience. And you need to get through the paramedic program, and like I said, that's a few years. And for a fire department, we like to see that you volunteered somewhere as a firefighter as well. The last thing we want to do is hire somebody, send them off to the academy, and then find out that they're claustrophobic or they won't climb a ladder, and it's no good for you, it's no good for us, we've got to find somebody else, and certainly you don't want to be doing a job that scares the heck out of you, right? So, all in all, it's about 5 years is a reasonable amount of time to get into the field. Go ahead.
What's like the starting period, like how much money? I know it's like a
Sure, absolutely. Yep. So, Connecticut's pay scale is actually on the higher end of public safety. An EMT can expect to start, I want to say EMTs right now are starting at about $15 an hour for a commercial ambulance. So ambulance services or EMS services are divided into different categories. We've got a commercial ambulance, which is a for-profit service that moves patients either for emergencies or non-emergency transports between hospitals. Some EMS services are municipally run, which means the city or township manages them, and they get municipal funding. Some are run through the fire department, and which means that they're part of the fire district, and they fall into a different rank structure and funding mechanism. Some ambulances charge for service, some do not. Some ambulances actually only work on volunteers, and some work on all paid people. So depending on what kind of service you're starting with will affect that. I would say a range for an EMT starting off is somewhere between $10 and $20 an hour. Yep. Paramedics right now in Connecticut are starting at, I think, again, big range, somewhere around $16 or $18 to somewhere around $27 or $28 for starting, in that range. So our firefighters, we hire our firefighters on, again, with a paramedic license, and while we're sending them to the academy in their first year, our paramedics are starting pretty close to $50,000 a year. And by the time they've been with us for 5 or 6 years, our paramedics, with working some overtime, with keeping up on their training, we pay them for their training, we cover some other expenses. Altogether, our paramedics are averaging somewhere between $80,000 and $90,000 a year as paramedic firefighters. Commercial ambulance is just about right there as well, $75,000 to $85,000 a year. So, some people look at EMS and say, well, you know, I could probably make more money elsewhere. Quite frankly, our guys do pretty well. I think that's a pretty solid pay structure. And again, it varies depending on what type of EMS you're doing or what service you're with, but the range is pretty good, and the guys have the opportunity to make a fair amount of money. So, and there's other things too, depending on where you're working. Some services offer, still a lot of the fire services around here offer pension programs. Everybody, just about all the commercials and municipal services offer insurance. They offer some other benefits with your pay. To make it a pretty decent career field now. And again, that hasn't always been that way either. That's really evolved over the last 20 to 30 years, that EMS is more of a legitimate standalone career path that competes with the other public safety disciplines, police and fire. And that brings up another interesting point. So we recognize that the police department falls under public safety, and we recognize that the fire department, generally speaking, falls under public safety. But EMS has kind of had this identity crisis since the beginning. Well, in emergency medical services, we help people. We provide first aid and medical care in the field. So what is that? Well, it's a public service, yeah. But you could make a good argument that that really is a healthcare choice, right? Those are healthcare functions. But we take those same people and we send them to car accidents, and we send them to other, somebody who fell out of a tree, or somebody who got, somebody who's sick in their home. That's not traditional healthcare. That's public safety, right?
No, it's still healthcare though.
I would agree with you. I think that, so EMS is unique in that a lot of what it is healthcare. A lot of what it is public safety. We merge those two. So, yeah, right. And depending on the service you work for, it might be more healthcare. It might be more public safety. In my case, our paramedics are all firefighters as well. And every time we go out the door, it might be to help somebody who has a public safety emergency. It might be to help somebody with just a simple medical problem. But we are multidisciplined, and we go to any 911 call pretty much. Whereas other, you may be an EMT or paramedic working in a hospital setting, that really your job scope is more health. So it varies. Emergency medical services in some states fall under the Department of Public Health. In some states fall under the Department of Public Safety. In Connecticut, the fire department is under public safety, but emergency medical services is still governed by Department of Public Health. So there's opportunity for conflict there sometimes when you have multiple governing bodies, governing agencies making rules that may impact one agency in different ways. So that's another challenge of the field. Go ahead.
Okay, I want to say something and I have a question.
Sure.
Okay, when you said that you went to like car accident and somebody fell out of the tree and stuff, I still think that's a healthcare thing. I don't think it's public safety.
Sure. Well, you know what? I think the function of treating the person in the car accident is healthcare, and I think the function of getting them out of the car with specialized tools is public safety. So I think in a lot of cases, you have two focuses being handled by the same group. I agree with you.
Okay, and my question is, have you been in any other career?
Have I been in any other careers?
Yeah.
Well, on the side, so another neat thing about fire department schedules, okay? As a firefighter, early on, we work a rotation. We work 4 work groups. I would work 2 day shifts, okay? So if today was my first day working, I would work Friday day, all day, Saturday day, and then I'd work 2 night shifts, Sunday night, Monday night, overnight, 14-hour night shifts, and then I'd be off Tuesday, Wednesday, Thursday, Friday. That's a lot of free time. So you'll find that a lot of firefighters that work a rotation, that they're working half the time and they're off the other half of the time, working other jobs. I personally used to own a small construction company, and on my 4 days off every week I would go build decks, do additions, that sort of thing. I look at it as kind of a part-time extra job, other than a separate career path. But you'll find we actually employ a lot of firefighters that have a trades background as well, and they'll do that. You know, plumbers, electricians, on their 4 days off from the firehouse, they'll go work in those trades as well. Yeah. So scheduling is good. My schedule now, I work Monday through Friday as a kind of an administrative position, so I don't have any other. I don't do that on days off anymore.
What do you think like the best experience you had being on EMT? Like, what was the most?
That is a good question. The best experience, like I said, I've been doing this for just about 20 years now, and in 20 years, I have had the opportunity to help a lot of people and see a lot of people smiling or even just breathing because of something me and my crew did. To put my finger on just one would be very, very difficult, but as a whole, I can look back at my career and be very satisfied that we've done a lot of good for a lot of people. Can I name one? Like a specific call? That is tough.
Well, wouldn't it be like a direct impact on people's lives? That could be like an overall.
Sure. All right. So one of the most critical calls that we do is when somebody's heart stops, right? And sometimes, you know, usually when somebody's heart stops, that's going to be the end for that person. It doesn't happen that often. In this area, for somebody who's witnessed, somebody sees their heart stop, sees them go into cardiac arrest, we have about 15% of those people will ultimately survive. And one really, really good case for me was a younger person in their early 20s whose heart stopped, and she had somebody with her to call 911, and we were able to respond, treat her, and get her heart started again before we got her to the hospital. And she just sent me a card last year with a wedding announcement.
Oh,
So that was nice. Yep.
Are you going to the wedding?
No, we're not going. But she was a thank you to the department that hey, I recognize that I'm able to get married today because of what you guys did for me.
What's the worst experience you've had?
Well, there's been a lot of pretty bad ones, and I don't want to get into bad calls in this arena. But one of the downsides to the career field is that you're going to see some pretty horrible things. We see the best of people, and we also see the worst of people. And without describing anything in particular, you watch the news and you see what's going on and what happens. And police, fire, and EMS are the people that go to these things and sort them out and try and make them better. But there's a lot.
Have you ever gotten like really emotional on one of your calls? Like,
Absolutely, sure. Yep. Afterwards. Yep. Yeah. In this career field, you can't let it affect you immediately. What's that?
You have to get it out eventually.
Eventually, yeah. You know what we do? We talk to one another. So when something impacts you in this career field, you know that you've got your other brother and sister firefighters and other EMS professionals that can relate to what you've seen and been through, and they're a good group to talk to about that. Sometimes, you know, if my wife's a school teacher, and she loves her job, and she has a very important job, and you know, on a lot of things we can relate, but she probably doesn't understand what it is to go to, you know, a car accident with several people who passed away. So that's something that I want to discuss with the guy that I work with, who's done that same thing before, and he can relate. And that's what we do. That's how we get that stress out, is talking to people that we work with.
Okay, I just want to say, okay, you know the girl you told in the 20s with the wedding announcement? So she had a heart attack the
Yep.
same day she was getting married?
No, this was years later. It was years later, yep. She got married about 3 or 4 years after this event.
Oh, okay.
Yep. So, yeah, go ahead.
It's kind of off topic in a way, but since this guy came yesterday, he had a 9/11 sticker on his hat. So
Yep.
what would you do with 9/11?
What was I doing?
Yeah.
I was working that morning. I was working with my regular partner on the medic unit, and the way I found out about that was we were walking into another call. We got a call for a woman who's having trouble breathing in a retirement community, and as we're walking through the lobby, another elderly woman stopped us and said, "Did you hear what just happened?" I don't know what you're talking about. We got to get upstairs. A plane just crashed into a building in New York. So she starts, and my partner and I are like, "What are you talking about?" And we're thinking, yeah, a little Cessna or something. There's an accident, no big deal. And as we're finishing up this call, you know, we're back in our truck and we're listening to the radio and we're over at the hospital and the pictures start coming up. So, you know, that's what we were doing that morning.
Do you work on holidays?
Yeah. So the other thing, you know, EMS, fire, police, we're 24/7, 365, right? We're never closed. You call 911, somebody's always going to show up. Somebody has to be there. We work the same schedule, rain, shine. We don't close for anything.
What about like disasters,
Sure.
like weather disasters?
Yeah. So with the fire department, I'll give you a couple good examples. Recently, three years ago or so, we had that freak storm in the middle of October, knocked out power for about a week. You guys remember this, right?
Yeah.
Remember where you were during that?
Yeah.
Yeah? Oh, uncomfortable at home freezing? Yeah. Sure, absolutely. So during that, our department, we bring in all hands. We get everybody working in rotation so they can rest a little bit. But we had a lot of extra people on for a week solid because we couldn't get down streets. We needed to coordinate with Public Works to have plows and payloaders with us to move trees and streets to get to people with emergencies. We had to check houses to make sure people were okay. And that wasn't a, you know, I'd call that a very, very small disaster in the grand scheme of things. But for about a week's time, the fire department was out every day until we could get that cleaned up, until we could make sure everybody was safe, until we knew that we could get to everybody who needed our help. Yeah, absolutely. Yeah, go ahead.
Has anything ever happened to the people in the fire department, like some of the emergency and money?
Sure, absolutely. So just like probably other career fields, once in a while one of our own gets hurt. Structure fires especially are dangerous. They're highly intense, and we put people in harm's way with a lot of training to deal with those things. But every now and again, somebody gets hurt for some reason. You know, somebody might fall through a floor in a building. Somebody might get hit with something, or something as simple. Our most common injury, what do you think it is in the fire department? Most common injury?
Burns.
You would think burns, but it's not. Our guys never get burned.
Concussion.
Not never, but rarely get
You're
burned.
talking about the guy, I thought you were
Yep.
talking about like the patient.
Oh, our guys, stepping off of a fire truck and twisting an ankle. Most common injury in the fire service.
Say that. They breaking the arm or leg.
Yep, but that type of injury could be common to all sorts of different career fields, right? That's not specific to the fire service. Periodically, though, we'll get somebody who gets hurt. We had a guy get hurt on a ladder last year at a big fire. Once in a while, we get guys that get hurt for doing different things, and just like any other career field, we get them help. They go through whatever treatment that they need to do to get back to work, and get back to work. Go ahead.
if a person gets really, really hurt,
Mhm.
and they can't go back to work, what happens? Workers' comp.
Fortunately for us, we don't have a whole lot of experience with that, but eventually if somebody can't come back to work, there's a process that they follow through the town to make sure that they're taken care of one way or another.
Wouldn't they go through like paid leave or something?
Yep, sure, that's kind of a benefit of the, yep. Was there another question in the back there? Did you have a question?
I also want to tell you, the bell's gonna ring, not,
Oh,
that would
okay.
surprise you, but.
Yeah, that's, yep.
But
So,
just a
kind
second.
of, yep, so we're gonna wrap up, I guess. So, I know that 50 minutes, 45 minutes is a brief period of time to cover a ton of information. And as you can probably tell, I could go on for about 8 or 9 hours on what I do. But I wanted to give you kind of a snapshot of what I thought might be interesting to you in these career fields. I'll certainly open it up to you guys. If you have other questions that I didn't answer, get them to your teacher, and I'll make sure that I can respond to them.
Thank you so much. I just wanted to help.
Oh, listen, I got
Great, I got 2 in a row. 2 days.